Hey, Eddie.
Good afternoon, Governor.
In recognition of Thanksgiving, this COVID update should be fairly brief today, but thank you for joining us. I'm pleased to be joined by Dr. Jose Romero of the Department of Health and also Secretary Johnny Key of the Department of Education. From the report that you'll see shortly, you'll see that COVID-19 cases are continuing to rise in our state. And compared with last week, we have over 900 more active cases than the previous week, and we have 69 more current hospitalizations than the previous week. That alone should tell you that we've got to be very cautious and wise in order not to have a surge like we did last winter. And I think we can avoid that with our increased vaccination rate. This week, as everyone knows, is Thanksgiving, and this starts the holiday season. And a year ago, that's the time frame that we started going up significantly in our cases and hospitalizations in Arkansas. The precautions that I ask everyone to take as you get ready for Thanksgiving are simply to be mindful that COVID is still in our communities. Protect yourself by getting vaccinated. If you haven't got your booster shot, get a booster shot. And of course, if people in your gathering are not vaccinated, then just be mindful of that and socially distance or protect yourself as need be, so we don't have an increase in the spread of COVID during this wonderful time of the year. I also wanted to address another issue before we start going through our case report, and that is the discussion on natural immunity. Studies have shown that natural immunity from COVID-19 is not as protective as the immunity you receive from COVID-19 vaccinations. So even if you've had COVID, you should get vaccinated and get a booster shot when eligible. I'll make a couple of points that I think are important. One, there is such a thing as natural immunity that you gain if you've had COVID. It is not something that lasts forever. It has an end date, and just like a vaccine over time loses some of its effectiveness, the natural immunity loses its effectiveness and loses it more quickly. Generally speaking, the immunity lasts about 90 days. And so I would encourage everybody to go ahead and get your vaccination, even if you've had COVID, and as soon as you recover, you should consider to do that and consult with your physician. And to illustrate this point, though, I wanted to reference this study of the CDC, which says a study of hospitalized patients with symptoms similar to COVID-19 found that unvaccinated people with a previous infection, unvaccinated but previous infection of COVID, that they were 5 times more likely to have a positive COVID-19 test compared to vaccinated people. And that illustrates the difference between the natural immunity and the effectiveness of the vaccination. And so our message is get vaccinated as soon as possible. And there is some good news because booster doses are increasing in Arkansas, but we need to continue to emphasize to get your first dose and get fully vaccinated, including your booster shot. Children ages 5 to 11 should also get vaccinated. As of today, we've given out 19,600 doses to kids 5 through 11. And that's 7.2% of the population, which we have a long ways to go, but it's a good start, and that is continuing to grow. With that, let's go through our case report. Over the last 24 hours, we've had an increase of 690 cases. That is a little bit down from a week ago, so that is helpful. The active cases are up 108, continuing that trend, and our deaths are 7. Very sadly, we've had 7 Arkansans die from it. The vaccinations, we've given out 11,640 doses or vaccinations in the last 24 hours, which is good. We want to continue to strengthen those numbers. The fully immunized is 1.4 million. You add that to the partially immunized, it's 1.7 million, and it continues to grow. Next, you'll see the hospital data where we've had an increase of 12, but most significantly, since last week, we've had 69 more hospitalizations since a week ago. Let's go to the next one. These are just a reminder of the counties that of course, these are high population counties that are having the larger numbers of COVID, but they're significant numbers to keep an eye on: Pulaski, Washington, and Benton. Back on the correctional facilities, though, 22 active cases. And I am very proud of our correctional facilities, keeping those active cases down in an enclosed environment and emphasizing the protective measures that they can take. And this is just a comparison as I do. The blue line is the ages of 12 to 15, and the red line is the ages 5 to 11. And you can see that the 5 to 11 are starting to get vaccinated almost at the same rate as the older category, and they started out behind, but that gap is closing. So that is an encouraging sign. Then this is the vaccination status of Arkansans 5 years and older. In other words, all of the eligible population is here. And I'm going to, and you can see if you add those two together, we're at, not add them together, but we're at 60% that have been the eligible population fully or partially vaccinated, a little bit more than 60%. This shows it in a different way. We have 50% of the eligible population vaccinated. You add that to the 11.2, so you got 61.6% of Arkansans partially or fully vaccinated, and we just started with the ages 5 to 11 and 5 to 11. So that is encouraging to me. And it shows the continued acceptance of the vaccine. Next. This is the daily average of cases by week of the new cases, and it just illustrates that the last 3 weeks, 2 weeks, we have gone up in our new cases, and that is worrisome compared to where we're starting could be a third surge. Next, you'll see the same trend line in just a different way, and I like to compare it with what we saw. That's August through March, and that last trend line, which were August of 20. So we see how we increased in a jagged fashion starting in October. It went up a little bit more in November of 2020, and it just continued to increase as we went into January and February, and then it dramatically decreased. The second wave was a little bit sharper. The decline was not as sharp, and we didn't get as high. Now we're starting up on what could be the third wave, and optimistically, with the vaccinations, we're not going to go up to the extent that we did in previous spikes. And the 7-day rolling average of confirmed probable cases, you see the trend line again. Let's go to the next one. And this is the active cases. You can see it going up to 6,079. And then you see this is just a reminder again of if you've been vaccinated, you have a much less chance of having an infection, hospitalizations, or deaths. And this is the hospitalized. As I've pointed out, it's gone up a little bit, but still not anywhere near where we have been in the past, and hopefully won't be there. With that, I conclude my remarks and ask Dr. Romero to come to share his thoughts on this, followed by Secretary Key.
Thank you, Governor. So I want to point out another group of individuals that should be vaccinated, and we need not forget about them, and these are women who are pregnant or about to become pregnant. We know that women that get COVID during pregnancy have a more severe case of the disease, and it can affect the outcome of the pregnancy. So we want to encourage all pregnant women to become vaccinated. These are safe vaccines, and they should be taken in order to protect themselves and their unborn child. Flu vaccine is very important this year. As we've talked about in the past, we had a negligible case of season of influenza last year, and the year before that, the beginning of the COVID pandemic, was a truncated year with also lower cases. That opens the door for a very severe influenza season this year. We're already seeing disease in states like New Mexico, and we expect to see increased number of cases here in the state. With regard to COVID vaccination in children 5 to 11 years of age right now. So our current cases, approximately a quarter of the cases that we're seeing are in that age group. It's very important that we vaccinate those children. As the governor pointed out, we're starting to plateau a little bit. We need to keep pushing forward on that area. And then lastly, regarding Thanksgiving and getting together. It's important that individuals receive a vaccination. At this point, if you haven't had a vaccination, you should get one. If you're going to visit relatives and you have any symptoms or haven't had the vaccination, there are available in-home testing kits that can be taken and would be advisable if you're going to see some of your older relatives. You want to keep individuals spaced if possible, the environment ventilated, if possible, have dinner outside, and of course, wear a mask if you are not vaccinated. And try to keep your get-togethers to immediate family if possible. So I'll stop there and turn this over to Secretary Key.
I do have some positive news to report regarding the number of active cases in our public school system. From the report yesterday compared to the report last week, we saw a decline of about 90 active cases. That's good news considering the trend we had been on. This week, as you know, is the Thanksgiving week, and many of our districts, if not most of our districts around the state, are out this week. So any cycles of transmission that were underway in our schools hopefully will be interrupted this week, and we will continue to see those cases go down as we see more vaccinations go up. Because we are in the Thanksgiving week, I was reminded last week when I was out visiting some schools and teachers, just how much work our teachers do, how much work our education support teams in our districts are doing, our principals. And I just want to say here a few days before Thanksgiving, thank you to all of the teachers, all of our educator support staff, all of our administrators out there for the hard work you're doing. This year is not easier than it was last year. In some cases, in some districts, there's some things that are even harder this year. But I don't want this opportunity to escape me without saying a heartfelt thank you to all of our educators in the state of Arkansas. Because of you, we are having another successful school year in spite of COVID-19.
Thank you, Johnny. With that, we'll take any questions.
What do you think is behind the increase in cases that we've seen recently? And do you think that the modifications to the school quarantine policies could be contributing to the increase in cases?
The modifications to the
School quarantine policies?
The latter answer is no. I think as indicated, the active cases, the schools have gone down. The schools are in a good position, and so we'll continue to monitor it, but I think it's been beneficial to keep kids in school, but it's also not had an adverse consequence that we can detect. In terms of the reason, and of course I'll invite Dr. Romero to make any comment, but I study it regularly just in terms of the trends, and we see what's happening in Arkansas happening in 2/3 of the states right now. The majority of the states are going up in their cases. You look at Europe, that has been ahead of us in terms of trend lines, and they're struggling now. And so The best indicator is that our hospitalizations are not going up at the same rate as the cases, and that's because our vaccination rate has gone up. But I think beyond that, it's hard to know and to predict exactly what COVID-19 is going to do. But I would invite Dr. Romero to come and explain it all to us.
I don't expect to explain any better than the governor did. We just have to expect this from COVID-19. We don't know exactly what's going on. We can hypothesize as to why this is happening, and it's multifactorial. First of all, there are probably still pockets within our state of individuals that are highly susceptible because they haven't been infected. Those individuals that may have been infected in the past, we now know, and as the governor showed the slide, those individuals are not protected for long term. It's a shorter term. They can be hospitalized and they can still have disease. And then we also know that individuals that did receive the vaccine, there is waning immunity, and so we need to boost that immunity back up. But as to a single answer, there isn't. We're still looking into that issue.
What's the percentage of total population that have been fully immunized? Yes, sir.
Yes, that number is, let me give you the exact number. 41, yeah, actually pull the chart. That would be
Pull
good.
that chart up on the number of vaccinated. I think it was like at 50%.
Yeah, it's at 50%. We added the children to that group, so that diluted it, and it's come down because of that.
We'll get that in a moment for you.
Yeah, I'll turn that back over to you, sir. Excuse me.
Yeah, there we are. I had it right. 50.4% are fully vaccinated, 11.2% partially vaccinated. And these are the eligible population. So that's 5+. If you look at the entire population, we're probably down to about 49 or 48% fully vaccinated.
Governor, with the Board of Apportionment set to vote on finalizing the new House and Senate districts on Monday, what kind of changes can we expect to see to the maps that were released? And will the board be addressing concerns that some public commenters have expressed about the way cities are split or about minority representation?
Well, in terms of any changes in the map that was presented by the Board of Apportionment, it should be based upon public comment. I know that the staffs of the three members are working very diligently reviewing the public comments, and everyone should know that they do make a difference, and they're all examined. Sometimes we can make the change, sometimes we can't, but we're looking at those. And so I would encourage people to continue to make a public comment, but we're working through those changes. Was there anything remotely?
Good afternoon, Governor. Brett Raines with 4029 News. We hope you have a good Thanksgiving, of course. Sorry in advance, we have a few questions for you. Briefly, the President Biden just announced releasing strategic oil reserves in hopes of combating high gas prices. Your reaction to that? Do you think that will help Arkansans at the pump? And a few more questions after that.
So what did he release, you said?
Approximately 50 million barrels of strategic reserves.
Oh, yes. Well, I think that'll have minimal impact. It might have some short-term impact, but and perhaps it will have some help over the holiday season, but releasing reserves from the strategic reserve pool is not the long-term solution. It is increasing our energy production and lifting some of the federal regulations and prohibitions of this administration on production. And that's the long-term answer, as well as increasing our supply chain. What's the next question?
Couple last questions for you and Dr. Romero. We're hearing people say, if we're vaccinated, why should we be concerned if people around us are not vaccinated? And then topic 2, we'd like to hear from Dr. Romero on a study that we hear he's been working on regarding infection rates in schools with and without mask policies.
In terms of if you're vaccinated and you're around people that are not vaccinated, then I rely to a large extent on my immunity from vaccination. But if I know somebody has not been vaccinated, then I keep a better social distance from them, particularly, just to add another level of precaution. Did I answer your question, Rhett?
You did. Thank you so much, Governor. My next question, last question is for Dr. Romero. Thank you so much. Good afternoon, Dr. Romero. We're seeking a little more clarification. We heard you're compiling a study. I'll get right to the point. 25% of schools without mask mandates show a higher transmission rate. For context, what are your thoughts on that? Is that surprising? Should that be higher?
No, it's not surprising. So the findings actually are by our state epidemiologist, Dr. Sima, and what we have found, is that for those school districts where masking is mandated, is used, they have a 25% lower incidence of infection overall using staff and the students. If you break it into the staff and the students, it's 28% for the staff and 24% for the students. So this is exactly what we would expect. We'd expect to see a significant decrease, and this is statistically significant, and takes into account a number of variables, which makes this study that has not yet been published the strongest study to date nationally showing the benefits of masking in schools. A previous study from Georgia showed a 20% decrease in infection rate in schools at mass. So again, I think this is further evidence that mandating masks, or having that ability of the school district to mandate the mask, prevents infection in children. Children that are not vaccinated are at higher risk for complications. And I'll state this again, COVID is not a benign disease in children. It is not flu, it is not the cold. We know that it causes death. There have been 700 deaths in the United States due to COVID. This is now in the top 10 cause of death of childhood. And it now exceeds all other vaccine preventable deaths in the United States.
Any other questions?
Governor, Ken Miller with the Associated Press, sir. Have you decided, have you come up with a date certain on the special session regarding taxes?
First of all, from the reports I get, members of the General Assembly are signing on to the tax cut plan as it's being circulated. And as soon as we get a majority of both houses in support of that, then I will formally call the session, which I would be looking at the week of December 6th. But again, I want to make sure we have the support for the main purpose of the session, which would be the tax cut session. And that would be the focus of it. And as soon as we get that, then we'll be able to release the proclamation that would actually call them into session.
Thank you. And would you anticipate adding anything to your call?
There are
Any addition?
a number of items that are sometimes technical fixes or just needed items that have come up that will be added to it. And hopefully I'll be able to release those early next week whenever we are ready to get specific about the session itself. We'll show the additional items that will have to be included. But let me make it clear, the focus of this session is one principal point, and that is to lower the state income tax rate in Arkansas, and everything else is just supplementary to that.
So are you ruling out the potential of a Texas-style abortion issue, abortion consideration?
I'm hoping that we'll have additional guidance from the U.S. Supreme Court before the session comes about. It could be next Monday. And obviously what the Supreme Court says on the Texas case makes a difference. I'll study that and make a decision, but at this point, there's no intention of adding anything related to that matter to the special session agenda.
Thank you, Governor.
Mike Wickline, right here.
He asked the questions I was going to ask. So,
Okay, you got it? Well, with that, I trust everybody will have a good Thanksgiving, and we'll see you next week. Thank you.